Although California's unemployment has been on the rise since Governor Gavin Newsom's stay-at-home orders, a new poll released Friday by the California Healthcare Foundation and research firm Ipsos showed less than 4% of Californians with low incomes are ready to stop sheltering in place. Only 3.6% of Californians whose income places them below the federal poverty guidelines are ready for the stay-at-home orders to be relaxed. However, 78.7% of individuals in that particular income bracket believe they should shelter in place for as long as necessary. When the same question was posed to a sampling of all California residents, 75.1% said they were in favor of shelter-in-place orders, while 10.9% of those polled said the orders needed to be relaxed in order to stimulate the economy. Newsom has yet to announce when stay-at-home orders will be relaxed. "We have tried to make it crystal clear that there is no light switch and there is no date," Newsom said in a Wednesday briefing. Newsom also said that approximately 3.2 million Californians had filed for unemployment benefits through the Employment Development Department, EDD. Just last week, Newsom told reporters, $2 billion in unemployment insurance claims were dispersed, just in 1 week. Health insurance did not appear to be a worrisome factor for Californians surveyed. While 4.5% of low-income Californians reported being without health insurance, 43.3% claimed they were not worried at all about losing their coverage. Out of all Californians surveyed, 2.7% said they had no health insurance. However, 51.7% of those polled said they were not at all worried about losing their coverage. By law, Californians must either carry health insurance, pay a penalty for not having coverage when filing state taxes, or receive an exemption. While the enrollment period for health insurance in the state was originally slated to end in January, that period has been extended to June 30th. Being able to afford treatment for coronavirus may be a different story. 17.4% of Californians with low incomes report being very worried about how they will pay for COVID-19 treatment, with 27.6% claiming to be somewhat worried about it. Those numbers drop when all Californians are factored in, with only 9.2% saying they are very worried about affording the treatment, with 22% calling themselves somewhat worried. California residents who are insured are eligible for free testing for COVID-19. However, according to an April study by America's Health Insurance Plans, the average cost for coronavirus treatment is $30,000. Recent data from the California Department of Public Health indicates a total of 39,254 positive cases of coronavirus in the state, with 1,562 fatalities attributed to the virus.